first through email as requested are those that we'll be addressing first.
Right,
So-
and Laura said, yeah, and Laura said she put some slides in her presentation to address some of those. So,
Awesome.
but that hopefully will reduce whatever.
Would you want to like ask the questions that were already submitted if I didn't already address them?
I was going to send those
I
to you,
have it
wasn't
in my
I?
email, but I would have to clean it up a little to be able to actually
Right,
see
you know what?
it.
I'm just going to go to my, I'm going to my email now so that I can print out the questions. Or Karen, do you
Yeah,
have
Laura-
the questions?
Laura, I don't, but Laura,
Okay.
you're absolved from trying to track all this down. And Anne, I can get those questions if you cannot.
Okay, I'm just.
It just, it
Okay.
can be embarrassing if I start bumbling around while everybody's watching.
Yeah.
Opening emails.
No reason for you to have to do that.
I
So,
am just looking for the email. La, 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 la. There we go. Here's the email that I'm going to send
Got
to
it?
you all. If I can just figure out where
Okay.
to send.
Laura, don't look
button.
at it.
Yeah, I've got it pulled up already, so.
Do you? Okay, well, Erin, can you perhaps do what Kendra did before and kind of riff off of those since you have them in front of you?
I can try.
We got your back, man.
We can bounce off each other too, you know, it's sort of, yeah, and sometimes, I mean, it's always okay to say we're not sure, but we'll look into it.
Oh, I think that's a really important thing. To
Yeah,
say,
so I'm
because-
going to be out probably from 9:20 to 9:30, and then I will be back in to provide support.
Okay,
But
well, we will absolutely.
last time as
be
I watched,
able- Go ahead, Karen.
no, that's good.
You know, everyone is relatively forgiving about how this all works.
We were just talking about forgiveness recently, and how it feels like suddenly there are the balls that we've been juggling have been gestating and having babies. So now there's like 3 times as many balls as there were somehow, just all of a sudden. And it goes back, I think, to the triple I, you know, the insurrection, the inauguration, and the impeachment. I mean, just those 3 national story through lines are just, they're soul sucking in some ways, and in other ways, you know, we're paying attention to what we need to pay attention to on top of all of the work that we're doing. So I feel like most people are being really graceful for themselves and others at this point.
Mostly, yeah, you know, things were busy before, but it just feels like it's ramped up 1,000 times more. Hey, George.
Morning.
Good morning.
So before you guys got on, I was hearing from Aaron that his 4 sons are back in school today. Woohoo!
First day, all of them are back.
That must feel
Oh
so
my
great.
gosh.
Yeah, I just hope it lasts, but it's been a long, long school year.
What grade?
The thing is that they keep changing it, you know,
Wow.
like every time you get used to something, then it changes.
Yeah, that's really been a hard part because they have been hybrid. They've been, you know, all virtual, but different schedules virtual. They've shifted it a lot and just keeping.
Recording, there we go. All right, welcome everybody. Thank you for being with us this morning. We're very happy to do our, I guess, part 2 of our public health, COVID public health considerations for the arts industry. This is a presentation of Arts Wisconsin and the Wisconsin Arts Board. We're very happy to welcome Dr. Laura Cassidy of the Medical College of Wisconsin with us, and special guest, Erin Scherer, Director of the Payne Arts Center and Gardens in Oshkosh. So first, about Arts Wisconsin, we are the state's community cultural development organization. We are all about the arts for everyone, everywhere, and we advocate for the creative economy and economic workforce and community development. And if there's anything we've learned from the pandemic, it's that creativity is the resource we need to get out of this and back into the 21st century. So we're all about advocacy, service, and development. And we're very happy in the last 11 months, more than 11 months, especially to partner with the Wisconsin Arts Board, the state agency dedicated to the arts, culture, and creativity. And Karen, please introduce yourself and the Arts Board.
Good morning, everyone. I'm Karen Geschko. I'm the Assistant Director at the Wisconsin Arts Board, and it is great to welcome you to this session. The Arts Board is Wisconsin's state arts agency. Every state has one. We receive funding from the National Endowment for the Arts and from the legislature. And with those investments, we provide grants and a number of technical assistance services to the Wisconsin community. One of those services is hooking up with Arts Wisconsin for these resource sessions. And it has been lovely to be able to turn to Dr. Laura again and say, would you please do a part 2 of this remarkable information sharing that you do, and focus this time on visual arts organizations and concerns that they bring up. So with that, I'm going to turn it back to you, and then Aaron and Laura. Good to be here with you all.
Thank you. Also, just to let everybody know, George Sugros, who's the director of the Arts Board, is also with us. So as Karen said, we're really happy to be partnering on, we're not happy about the pandemic, but we're happy that we have been able to work together to provide as much information and resources as possible. So today's session, Dr. Laura Cassidy is professor and director of epidemiology at the Medical College of Wisconsin. As I said, Aaron Scherer is the director of the Pain Arts Center and Gardens in Oshkosh. Laura has a presentation that she's going to go through, which will give you an overview. You know that we are focused more on visual arts organizations this time around, since we focused more on performing arts organizations last time in January, but all of it applies to every part of the sector. After Laura's presentation, we will launch into questions. We received some questions beforehand, so we will go through those. Also, Laura will answer some of them in her presentation. And if you have a question, please put that in the chat box, and we will do our best to get to as many of your concerns as possible. And if we don't get to them in this hour, then we will we will do lots of follow-up. So with that, Laura, thank you so much for being with us again. And I'm going to be the screen mover. So,
All right.
hang on, there we go.
Well, thank you for inviting me to spend some time with you this morning. I'm going to go through my slides pretty quickly because I think it's more important to have time for your questions. I'll do my best to answer them, and Aaron will help, and or he might end up answering all of them. And then if there's some that we're really not sure, then we will look into it. We'll find information and we'll share it with you later. So I'm just going to go over some of the epidemiology really quickly and about transmission that leads into where we are with vaccinations and health and safety considerations for operating during the pandemic. Next slide, please.
Is that the right one?
Yeah. So I think by now we're all pretty familiar with the fact that it's a respiratory virus that goes in our nose and mouth and comes out of our nose and mouth. And there's been enough research that shows that the further you are away from somebody, the less likely the droplets can get to you. And also with masking, that makes a huge difference, both for the person who might be infected and the person who might be exposed. But it really, this is like the primary basis for most of the health plans with operating during the pandemic. Next slide, please. And so before everyone's vaccinated, we have to practice these non-pharmacological interventions, and they've been shown to work. So really the way the exposure works, it's based on the number of people you interact with, how closely you interact, the intensity of the interaction, and the duration of the interaction. And this is important because it'll drive a lot of your health and safety plans when you do open, or if you are open. And while they say avoid crowds, stay at home, work from home, the key is to not interact. The more people you interact with, the more chance you have to either spread it or get exposed. And we talked about distance is important. And then for the, especially for the performing arts, things like singing, or if you're speaking loudly, you can project the particles further. We know that indoor activities can increase spread more than outdoors because the air flushes things away. And we know that wearing a face covering and washing hands makes a huge difference. But there's also the time of exposure. So the CDC defines a close contact and a potential exposure if you're within 6 feet of somebody for 15 minutes. So 15 minutes or more. So this is where those come from, because it's this, all these factors play into your risk of exposure. Next slide, please. And so the vaccine started rolling out in December to healthcare workers, and then was expanded to those over the age of 65. And so I thought it would be good to not just show where we are, but where we've been. So this is the 7-day percent positive by day of the number of people who get tested, how many test positive. And you can see in the beginning of the pandemic, when it went up to between 5 and 10%, and then, oops, I forget, you can't see my screen, I'm using the pointer. And then in mid-November or early November to December is when we saw that big peak. We were at like 18% positivity, which is way too high. We want to be below 5% of the people who get tested test positive. We want that down low because that's how we measure community spread. So as you can see where we are right now on the far right, we're at about 2.7%. So this is the best we've been in a long time, since early June. And this is encouraging, and we really hope to see these trends continue. Next slide, please. Part of that's attributed to the post-holiday rush, part to the vaccine, and part to people's safe behaviors, and to some mix of natural immunity and vaccinated immunity. The thing we always are concerned about are hospital capacity. Do we have the capacity to care for our patients? And back in November, December, we were really full. Our hospitals usually operate at about 60 to 65% capacity, and we were up close to 90%. And if you get into some of the more rural areas where there's smaller hospitals, you know, you can't have a situation where there's one hospital bed available or one ICU bed available during a pandemic. So this was the huge concern we had, that we, the big red flag that we really need to get this under control, because we need to be able to take care of people. So where you can see today is where our hospital capacity is much more manageable. Our ICU capacity is down. We have plenty of ventilators. But the important graph, I got this from the Wisconsin Department of Health website, or I would have made this graph bigger, but on the very bottom where you see that line chart, the different colors represent the different counties across Wisconsin, with the green line being the southeastern region. And so you can see the trend over time of our how many patients were hospitalized. And again, in December, you see that big peak where our hospitals were very full, and it was very scary. And you can see how sharply it's come down since then. So that again is encouraging. Next slide, please. And then when we look at the total lives lost, as of yesterday, we've lost over 6,300 lives in Wisconsin alone. And the graph here shows along the x-axis is by date, starting at the beginning of the pandemic through a few days ago. And the bars are the actual numbers of new deaths every day. And the yellow line is a 7-day average, so you can evaluate the trends. And you can see how when, you know, fall came around, the deaths went way up. And there's many different explanations for that, you know, going indoors, kids starting school, more community spread. When it spreads fast and it peaks. And then so first people get ill, then they get hospitalized, and then the deaths follow. So, you know, again, what we really want to prevent are people from dying. And as you can see, that's coming down along with hospitalizations, as we would expect, which is encouraging. Next slide, please. And we talk a lot about herd immunity, and you hear everybody saying we need to get 70% of the people vaccinated to get back to normal. And I think this can be a confusing concept, because I prefer the term community protection. What it means is that if enough people are vaccinated and are immune to the virus, then the virus has nowhere to go and it can't spread. So if some of the people are not vaccinated, they're protected by the people who are. And when this pandemic struck, it struck so hard so fast. And one of the reasons is because it was a new virus, new to everybody in the world. Nobody had immunity to this virus at all. So everybody was vulnerable. So every time it came in contact with somebody, it could spread, it could make people sick, and people could lose their lives. So now there is some natural immunity to it from people who have gotten ill and recovered, but we don't know how long that immunity lasts. We're still learning about that. And the reason we don't know is because it's only been around for a year. We do know that vaccines do really protect people. They protect you from getting severely ill. And so if we can get enough people vaccinated, then we can really get this pandemic under control. So that's the key message there. Next slide, please. Okay, now I'm going to talk a little bit about vaccines. Next slide, please. This is always the hot topic. I think everybody probably knows there's two that are currently authorized, and those are the Moderna and the Pfizer vaccines, and those are both 2 doses. The Pfizer vaccine the doses are 3 weeks apart. Moderna, they're 4 weeks apart. And the reason for this is because our bodies are new to this. We need to build up immunity. So you get the first shot and your body learns to recognize that it teaches your body to recognize if you're exposed to the virus and to fight it off and to develop antibodies. So you start developing antibodies. And then the second shot's kind of a booster shot where, okay, your body's been trained, but now we really want to kick it in gear. And so that's why the 2 shots are important for this. And I think today, actually, the Johnson & Johnson vaccines being reviewed. So we're hoping that will be authorized by tomorrow or over the weekend, and they can start delivering vaccines next week. And this is really important. Johnson & Johnson's 1 shot. It isn't as fragile as the other 2. It can be distributed widely. It's created more like a normal vaccine, like we have for the flu and other things, where it doesn't need special freezers. It lasts longer, it's more mobile, and they have the production lines highly developed where they can really start, cranking out some vaccines. So that's really important. Now, when we talk about efficacy of the vaccine, and you'll hear that Pfizer and Moderna are 90 to 95% effective, that means that's way more effective than we ever dreamed. The flu shot's about 50% effective. Now, Johnson & Johnson's somewhere around 66 to 80%, which is still way better than we ever expected. So if you have an opportunity to get a vaccine, any vaccine is good. Any vaccine that is authorized is better than no vaccine and will provide protection. It's likely we might need booster shots every year as the virus mutates, just like we do for the flu. Next slide, please. And I think we'll see a big difference as production ramps up for these. And we talk a lot about these phased plans for, implementing it. And we started with healthcare workers because we wanted to be able to protect the people who take care of us. We want to keep them healthy. They've had a stressful year. We want to make sure their immunity is built up because they have the highest exposures. And then other emergency personnel like police and fire, those over 65 years of age, because the people over 65 have the highest risk of severe disease, highest risk of hospitalization, highest risk of death. So the first thing we want to do is we want to get the hospitalizations down and the deaths down and prevent the suffering. And then it'll start, I think next week, it'll start rolling out to education and childcare workers and some other essential workers. But it's not like we have to get all of phase 1 vaccinated before we can go into phase 2. It's just, I think of it as an upside down funnel as we're widening the band of who we can handle vaccinating, because we just have to do it in a logical way because there's so many more people who need to be vaccinated than there are currently available. And I do think it's encouraging that across the country, and if we see hospitalizations and deaths going down rapidly. And if you look at Israel, I think they have the highest rate of vaccinations, and we're seeing a huge difference there. And we're seeing that the vaccines are very effective. So this is a really exciting time after everything we've been through and talking about everything. This is really encouraging. Next slide, please. And so, people are concerned about reactions. People are concerned about the vaccines. These are incredibly safe vaccines. There are, people experience symptoms with them, especially arm tenderness. We can handle that. I just tell myself I did a good workout with one arm. But, people have experienced fatigue, maybe some chills, maybe slight fever. And that's really nothing to be too concerned about. It lasts about a day or two, and you can take some Tylenol. And what this really means is that your body's recognizing it. It's recognizing and learning to fight, and it's responding. So it's in training. And so, it's important. There's some studies that show that younger people have more symptoms when they get the vaccine than those of increasing age. And it could just be because how our bodies respond to things over time. But with the second shot, if you get the 2-dose, the Moderna or Pfizer, the second shot, people have reported a few more symptoms. So when you're eligible to get the vaccine, you might want to try to do it on a Friday. You might not have a lot of choice when you get an appointment. Just take it if you can. But you might want to, try to schedule some time if possible, just in case you feel a little under the weather. And there are, very rare events where people have a severe allergic reaction. And so when you get the vaccine, they keep you and observe you for 15 to 30 minutes to make sure that you don't have any of these reactions. And if you do know that you have severe allergic reactions, talk to your physician about it, let people know. But for example, the rate with Pfizer is out of every million people who get a vaccine, 5 have experienced this severe allergic reaction. And with Moderna, it's 2.8 per million people. So it is very rare, but if you have risk factors, then talk to your physician about it. And again, in Israel, where I think they have either 25 or 40% of their population vaccinated, they're seeing a huge decrease in cases. And so this again is what we want to see. Next slide, please. And then again, this is where we are as of yesterday in Wisconsin. So in Wisconsin, we're actually doing pretty well. And as of yesterday, 14% of the population have received at least 1 dose. 6 to 7% have received both doses. And this is a little bit small to see, but in the bar chart by age, you can see it's skewed mostly toward the people over 65 who we're targeting. The rest are probably healthcare workers and essential workers. And the bottom orange bar chart shows you how many we're doing per week. So we're up to about 200,000 doses per week. And we expect that to increase. So that is encouraging too, when you figure there's about 5 million people in Wisconsin, that we can reach a level of herd immunity potentially this summer if we get enough vaccine and people are willing to take it. Next slide, please. So that's a little bit of the background on the epidemiology, the vaccines, where we are, and how will this impact how you function currently and moving forward. And so for the performing arts, I had created a health and safety checklist, and there are others around. I did some Googling, and there's just like some basic principles and considerations. And it's going to vary depending on your venue and your how large it is, how small it is it indoor, outdoor? But the things you really want to consider that we've learned, and we've learned this through other businesses, through restaurants, through performing arts, is that one thing that's important is if you have somebody who will act as your internal health and safety champion and really take the lead on ensuring the health and safety plan is implemented and stays up on the guidelines. There's almost everywhere there's somebody like me who really likes reading all this and getting into it. And also know who your local health department is and who the contact is, and work with them so that if guidelines change, you don't understand it. If you do have an outbreak, you can contact them. They can do contact tracing. They know what to do. They can guide you on quarantining. So it's really important to work with your local health department. They can be extremely helpful. And then, sharing information with other venues. There's a lot of different protocols online and things you can see, but like even today in this webinar, there's other people on it where you can share information with each other and help each other, share protocols with each other and learn from each other, because we're all figuring this out as we go. Disinfecting practices are, of course, very important. And there's on the EPA website a list of EPA approved disinfecting agents that you can use. We all know about physical distancing. Trying to remain 6 feet apart is very important, especially with these new variants that are out that keep emerging. The virus is going to keep mutating, and the current ones they believe are much more contagious. And so far, we don't really know if they're more severe, because if they're more contagious, they can get to vulnerable people faster. But the thing is, we know masking and distancing works, so, we just need to keep it up. And then like masking with your PPE protocols, you don't really need to wear gloves, but when you're disinfecting, you should. Communication is key, really, so that people know what to expect, so that the people who work in your environment know what to expect and what's expected of them and what to do if there's a problem. And also your customers and your patrons, when they come into your establishment, making sure that they know that you expect them to wear a mask, that you expect them to keep social distancing, whatever your rules are. So having that, if you have a website, having it on your website, having it posted, if you do ticket lists, online tickets, so that it comes up and they know, the more people know what to expect, then the more they will be compliant with the guidelines and the less problems you'll have. Have a response plan in case somebody does get sick. So if you have staff members who get sick, or you have an event at your place and you find out 10 people got sick, what do you do? You have to shut down for a day, disinfect, depending on how many people or what it is, work with your health department to see what their plans are. Consider vaccinations. I mean, we highly recommend them. They're so safe. It's, so much easier to get a shot and maybe feel tired for a day than it is to take the risk of getting ill and it being one of these long haulers even. I mean, we don't really know the long-term consequences. So, when it's available, whatever your health insurance, it's free to everybody. But, if it's a way to stagger shifts so people can get it or make it easy to get them, just think that through. It's really important. And then technology is evolving, testing is evolving. We're getting more comfortable with home test kits that'll make things easier until enough people are vaccinated. And I put a website on here that I found about specific to museums, but that had a lot of really good information on it. Next slide, please. And then once you're opening and operating, this is when you're getting ready, and maybe you're already ready, maybe you're already there, but when you're operating, what they recommend are things like advanced tickets, time ticket entry, so that you can monitor the flow of people going through, because the one thing we don't want is a crowd. If you have a special event or it's the first day, you don't want everybody rushing in there all at once. You want to time the people as they move through your venue. Prepaid parking, the more you can limit humans interaction, which goes against our nature, but for now at least, the better. If somebody is not feeling well, encourage them to stay home. Your employees, encourage them, if they're not feeling well, stay home, get tested. You can have a little screening survey of symptoms before people come into your venue, and information, again, letting them know if they have any symptoms, coughing, fever, shortness of breath, loss of sense or smell, please don't come to the venue. And again, communication. If you have events, if you host events at your place, then make sure you have protocols. The CDC has a whole website on gathering protocols, but protocols for events. And there are capacity limits. And in general, how the health department calculates them is, if you have so many square feet, how many people can you fit in there based on the size, and that they can be 6 feet apart. And so you may not be able to do events at full capacity. You really don't want people crowded in. Marking the floor works one way in and out, having certain doors for entry, certain doors for exit, so people aren't passing. I've seen some really creative ways of marking space on the floor to keep people 6 feet apart. And again, the face coverings are so important. Next slide, please. And then I get asked a lot about indoor ventilation recommendations. And, I'm going to tell you, I'm not an expert on this, but I did ask our engineering experts at MCW. And there's this, I don't know how you say it, ASHRAE website down here. And that's what they recommend following. And the basics are keep your HVAC in good working order and provide ventilation to code. Use these MERV 13 or higher filters. The more outdoor air you can get into an event, the better. And then if you, depending on how your space is set up, putting local HEPA filters are around. But I put this website up here as a resource for you to look at. And I know other people in your area have recommendations on this as well. Next slide, please.
And we will send all this information out after the webinar, by the way.
And again, you know, people question masks, and it's one of the best things we can do to prevent the spread. And so wearing it correctly, they've done different studies now that a tight fitting mask is really important. Wearing it correctly, you have to cover the nose and the mouth, have it tucked under the chin, tight enough behind the ears. I see so many people with it under the nose, and that's where we carry the highest level of viral load. Some of these new strains that are out now with studies, it suggests that one of the reasons it's more contagious is because you carry a higher load of virus in your nose, and that's how it spreads. So especially now covering the nose, huge. And they are recommending double masking now. So any mask, any face covering is better than none. We don't recommend those gaiters that hang down. We do recommend one tight fitting around your chin, 2 layers, and you can also put one on and then put another one on top of it. So that's an extra layer. We have all these layers of protection. It's just not one thing, it's a combination of things that really keep us safe. So with the next slide, I will stop there and allow sufficient time for questions.
Okay. Okay. Oh, thank you for all of that. Thank you. That was extremely informative. As I said, we're going to share all of this information with the people on the call, on the meeting, and around the world. So don't worry about the taking of notes. We will make it all available, including the recording. So, Karen, are you there? Or I guess I will just say, Laura and Aaron, do you want to launch into the questions that we've already gotten? And then I think we have a few more we will undoubtedly have more. So I'll kind of leave it to you to take it away.
Good morning, everyone. I'm happy to try to help facilitate today with questions. I work at the Paint Art Center and Gardens in Oshkosh, Wisconsin. We have been open to the public since the very end of May, just right after the stay-at-home orders were lifted. And I was relieved to see Dr. Cassidy's presentation on protocols to follow, because I feel like we've done pretty much most of those, created a task force to right at the beginning when we first closed to address what would it take for us to open. Took reservations, timed reservation system since May. The cleaning protocols, the expecting guests to wear a mask protocols. And things have been very well for us. We've had, last year we had more than 20,000 people visit. They were all spread out spaced during the holidays. That included 12,000 people. And as far as we know, we had no staff test positive, and we did not hear of any exposure or transmission on site. So that's a relief, but I do think so, like Dr. Cassidy said, you know, you do as many things as well as you can do. It's not one thing, but it's many different things. We did receive a lot of questions. One of the first ones we got was from probably Sam at the John Michael Kohler Art Center, asking about ionization equipment and if it's really worth the investment, if it's effective enough to justify the expense. I don't know, Dr. Cassidy, if you feel like you have the expertise to speak to that.
Yeah, you know, we've gotten asked about that a few times. So I emailed our engineers to ask them. When I first asked them what they recommended, they sent that link that I shared with you. And then I emailed them back. They might be getting sick of me. And I asked about the ionization. It's my understanding that it's pretty expensive. So I'm waiting to hear back from them. And when I do, I can share it. It could be something where it just depends on your venue. But we've seen that a lot of these other things, if you do all of them, it works pretty well.
I know.
Sorry to interrupt you, Aaron, but I know that in the first session we had discussion about systems that air filter systems. So there is some information that we have, but whatever you have, when they answer your questions, we'll keep adding to it.
Yeah.
Right. For smaller venues, I mean, the investment just might be too high.
Yeah,
probably.
We're kind of assuming so. We are having mechanical, electrical engineer or HVAC engineer come next week to kind of do an evaluation of our system and even see if it's possible. But at this point, we don't have that equipment. Tina Weiss from Kids from Wisconsin asked a lot of great questions. One thing that jumped out was just, and this might be more Karen and Ann responding, but public perception and what can the Arts Board and Arts Wisconsin do to kind of communicate, I think, a shared understanding of precautions. I do agree, and Dr. Cassidy said this, communicating with patrons about what precautions you're taking is very important. Since we took reservations, we asked people to read the precautions before they made a reservation. Once they made a reservation, they got the long list of guidelines again. And then we had them at the door and enforced them throughout their visit. So we had virtually no, very small problems with compliance because we pretty much hammered people with the information before they got here. And I think those who didn't want to comply mostly didn't. We did, I shared with someone else, but we did do a survey and asked visitors during the holidays how comfortable they were with our precautions. And we had 99% said they were comfortable or very comfortable, felt comfortable during their visit because of the precautions in place. And the 1% who felt uncomfortable, all of them complained that we were enforcing our guidelines too adamantly, and we thought that was okay feedback. During our visit, we would remind people to keep their mask on, to keep social distancing, but we didn't receive any complaints about people feeling we weren't enforcing protocols enough. And so that just kind of affirms that, guests will come and participate and enjoy the experience if they feel confident that you're going to manage the protocols well and keep them safe. But Ann, I don't know if you have any thoughts about the kind of shared public.
Just to support what you and Dr. Laura just said about you can't provide too much information and encourage people too much. Better to do that than not enough. And if I think we said this in the first session as well, if you make it clear what you expect from your visitors and enforce that, then people will make their own decision about whether they feel comfortable with what you are telling them they need to do to have the arts experience. So they'll self-select. And then, as you said, Aaron, you've got 99% of people who thought that you were doing it just right, and that's the feedback.
Jump in.
So yeah, go ahead, Karen.
I know that there has been talk, and I'm not sure where it is, so it really is a check-in. Talk of developing a visual that arts organizations can place at their front door, saying it's a consistent visual, so it's recognized by people, across the communities about, we're using the best practices, protocols, you are safe to come in, whatever. And I'm not sure where that conversation is right now. I don't know who took that on. It's certainly something that the Arts Board and Arts Wisconsin can work on if there is value to that. So let's put that to the side, and I would love some feedback or knowledge about that in the chat. If people wouldn't mind doing that. All right, thanks, Aaron, for checking in.
And
what's the next
actually,
one?
just to add one more thing to that, Karen. Somebody needs to mute. When I go to the supermarket, I've been to the supermarket and a few businesses. This must be a Dane County public health thing, but every single one of those has the same sign that says about masks and physical distancing. So I think that doing that for the arts community is a great idea. So yes, let's talk about that. Other questions that are out there or other comments?
George, I'm sorry, did you say something?
I was suggesting Ann talk about her poster project.
Thank you, George. I am so glad when other people remember the things that I should be remembering. So I'm going to include this with the follow-up information. We've launched a Keep Wisconsin Creative campaign. Arts Wisconsin is part of the statewide Stop the Spread Coalition, which is a coalition of health, economic development, civic organizations that are concerned with Wisconsin's health and well-being that have come together to promote the message about washing your hands, wearing your mask, and watch your distance. And so we've created posters that spread that message, and it's available for you all to pair with a photo from your organization or your community. And I will send that out to everyone if you haven't seen it so that you can use it. So thank you, George, for that. But again, we are, both the Arts Board and Arts Wisconsin definitely want to spread the message and help you educate audiences as much as possible.
We had a question from Jocelyn at the Racine Theater Guild. She, one of her questions, which I'm not sure about, but she maybe noted some performing arts organizations that weren't following the governor's mandate, and wondered if there is some type of process where you can ask for exemptions or, you know, to be able to move forward without following maybe the letter of that. I don't know of any, but if anybody else, I assume organizations are just kind of moving forward with the practices they think are best.
Right.
I don't know if...
And that also had to do with the fact that every county has its own public health guidelines that may or may not be similar to what the state and the feds say. You know, I think that what Jocelyn said in her message was that they're working with Racine County and the city of Racine to figure that out. And I think that's what organizations can do is have that direct conversation to not to sidestep the guidelines, but to see what is reasonable and feasible in the context of your organization. In the short and the long term, that's what you can do.
In the questions we had, Michael Sander asked, and I'm wondering, Dr. Cassidy, if you can answer this. So if they're an organization that might have employees, I believe this is what he's asking, that would qualify for the vaccine at a certain stage, who do they contact to ensure that their group is included and that they can communicate that to their staff?
Yeah, that's an evolving question. You wouldn't think it'd be as difficult as it's been. The first thing they recommend is you go through your primary care physician. The other thing you can do is go through your local health department. When the vaccines like Johnson & Johnson become more available, we're hoping they'll be more widespread at CVS and Walgreens and you know, local pharmacies, so that it would be like getting a flu shot. Right now, the demand exceeds the supply by so much that it's, you know, it's like every man for himself. I have my 80-year-old friend calling me and it's like, you know, this big competition to get a vaccine. How do I get one? And I'm like, well, you know, you have an appointment in 2 weeks. Maybe just calm down for 2 weeks. But in Milwaukee County, they have a website called Healthy MKE, where they post information on where you can get vaccinated. I don't know about the other counties, but on the Department of Health website, it usually shows where the vaccine clinics are. So in general, if you are in the eligible group and there's somewhere that has vaccinations, you can make an appointment, or there might be hopefully soon walk-in appointments.
I'm hoping that we start ramping up 24-hour sites in some way but that depends on the supply.
Also depends on getting enough people to stay up all night and get vaccines.
Well, but there are people, you know, people who work at night and come home, then you can stop off and get your shot. That'd be great.
Yeah, we have to make it accessible to people. It has to go to where people are and not make people go to it.
Right, right. Right now, it feels like a bit of a free-for-all. And whoever gets to the website first gets it.
I know where the pain is in our planning is that, as I said, we've been open all this time. The museum has been open. The point where we have a lot of questions now relates to programs and events. We did no programs or events last year at all, except virtual. And, you know, so we're trying to gauge safety levels at different, you know, periods for planning over the coming year. So I'm wondering, Dr. Cassidy, do you have a sense of where we'll be in spring versus summer versus fall as far as precautions?
Everybody's favorite question.
Tell us the future.
Yeah, my crystal ball keeps malfunctioning, but I know that, you know, the key guideline is community transmission. So the first thing is, like I said, we need hospitalizations and deaths to go down. That's the key. And then if our community transmission rates are low, below 5%, that's important too. Now, I do think in late spring, I mean, depending on the event with safety protocols in place, you know, if people are masking, social distancing, the community level's low, and you can avoid it from being too crowded of a situation, that we can get there. I think that, you know, as vaccine production ramps up, and as long as people are willing to take the vaccine, there are some people who don't intend to take it or need a little more time to feel comfortable taking it. And for those people, I encourage them to ask questions, to learn as much as you can from reputable resources to be able to make an informed decision about weighing the risks of the vaccine versus the risks of actually becoming ill with COVID. But, you know, I mean, you know, most of the experts are saying that by the end of the summer, we should be in pretty good shape.
I know at the
Fingers
Pain we're
crossed.
planning to begin events and programs in May, but through September, we're planning on anything we do would be outside. So we're not going to gather groups inside, except maybe small meetings where we can, you know, space people out, which we haven't done at this point. But a question that is outdoors, and I know this came up in the last discussion, and someone has asked it: if people are outside and socially distanced, do they need to be wearing a mask?
Okay, so again, I would think about the different situations. You know, if I have a couple friends over and we sit in the backyard and we sit over 6 feet apart on a nice day, you know, maybe not. But if you have a lot of people, say at an event, and you think they'll be 6 feet apart, I would still, you know, be cautious and wear a mask, because it's the density, it's the number of people. You know, people aren't necessarily going to stand in one place. They'll go to the bathroom or start clustering. So again, think about the situation that you have. If people are in place, you know, in a chair, I just think the safest thing is to wear a mask when the numbers are larger. I know that's what people want to hear, but I mean, I just think the more layers of protection, being outside and wearing a mask, you're pretty safe.
We all want the answer that it's fine. It's fine.
Yeah. In the question and answer, Kimberly Meller of the Wheel Center for the Performing Arts said that her organization got a quote for the ionization equipment, and then it was $16,500.
So the Wow Center is a big old movie palace. So I can see that it would be that much. So Kim, we want to know what you're going to end up doing.
Yeah.
Shopping around, probably. But that goes along with what you said about, I mean, every organization has to figure out what they can do, right, with the money that they have. I don't know if there are any grants out there that would help facilities get that kind of equipment, but that's something we can look at.
I think for all these questions, the best advice I can give people is, like, every situation's a little different, but there's basic principles to follow, right? Yeah. And you have to weigh how you minimize risk within your environment.
I don't know, Dr. Cassidy, I don't think you mentioned this specifically, but we've, in our organization, have paid attention to what the CDC considers a close contact. Mm-hmm. And so, like, our staffing policy is that our staff should never be in a close contact, but that's that 15-minute window. We'd like it to be, you know, less than 30 seconds, but it's not that our staff are never going to be closer than 6 feet, but we don't want them ever working in a situation where they're side by side, you know, for more than a few minutes. And same with guests, you know, okay, a guest might pass, they should always be masked, but might pass a staff member or get within that 6 feet bubble, but it should be, you know, a very brief moment. So, I mean, that, I don't know how you feel about that, but that's, for us, then we haven't really had exposure, but we had, if we did, the idea was also, okay, to limit the number of people who might, you know, have been impacted.
And that's good. I mean, if you can do that, you need to do it. And, you know, the 15 minutes is a guideline. It doesn't mean if you go 16 minutes, oops, you know, or 14 and you're safe, you know, it's, people want numbers. They want like boundaries, but, you know, I think just be smart about it, you know, and do your best.
Yeah.
Okay, let's see questions here. Someone asked a question just about like, they noticed someone's been wearing masks backwards and they wondered, you know, white on the outside, color on the inside, and wondered if you knew why they were doing that.
And is it effective?
People like,
okay.
I don't know why, and I don't know if there's a reason, but again, any face covering is better than none.
So a question of mine, and this doesn't necessarily relate to arts organizations, it relates to broadly everything, but once, this is just a true curiosity thing, once high-risk people have all had the opportunity to be vaccinated, why is it necessary for us to continue to follow all these precautions until we get to that, you know, 70, 80% immunity rate?
Right. So we want our high-risk people to be vaccinated again, so they don't end up in the hospital or die or have severe health consequences from it. But it doesn't mean they all will. And they're higher risk, but that doesn't mean there's no risk for other people. You know, perfectly healthy people have a bad outcome. So we're starting with the high risk to really get it, you know, the hospitalizations and deaths down first, but there are risks to other people. You know, I think probably everybody knows somebody or knows somebody who knows somebody who's a healthy 30-year-old who ended up in the ICU for 3 weeks. And the other thing is, the more, you know, so maybe, you know, there are a lot of people who can get infected, but have mild disease. And you say, well, it's like getting the flu. But the problem is, because this is such a new virus, that the more people that are infected, the more opportunity it has to mutate and, you know, become resistant, or to become, you know, more contagious, or create more severe disease. So we don't want it to have that chance. Now, I don't want my body to be a house for it to mutate, you know? So the way to get it under control is to not give it anywhere to go and not give it an opportunity to mutate.
Okay, that makes sense. Catherine Gorey asked, we were talking about the masking outside, that if she was working with students, is that as long as she kept them 6 feet apart, would it be okay for them to remove their masks? I know in our protocols that would be fine. I don't know, Dr. Cassidy, you know, if they're seated or stationed and they're distanced, that outdoors we've allowed masks to be taken off.
Yeah. And when you say students, you're talking about kids, I assume, younger people. And, you know, I think they do need a break, and I think that's okay. And, you know, studies have shown consistently that children under 10 don't get as ill. Some get very ill, but in general they don't, and they don't spread it as easily. So I think that's okay.
Steve.
And
Do
you see any other questions popping up?
Well, yes, there's a question here. Well, there's a question here about from Becky Johnson about organizations that primarily work outside in the summer, and we've addressed those, that smaller groups with the protocols that keep people in their bubbles. Well, it's not a great word to use, but in their, away from each other, are okay. I feel, from what I'm hearing, it's the smaller events with 50 people, or in an indoor setting, as you have said, Erin, with the protocols that you've put in place. I feel like last summer we were all in a state of shock and nobody really knew what to do. So people erred on the side of caution more than, they erred on the side of caution. This summer, first of all, we're all desperate to get outside in some way. We can do that. We now know that there are, as you've said, protocols that people can follow. And so I think that what I'm seeing is that people are planning outdoor events with the protocols as they can. It is true that there will not probably be big music festivals, and big events have to really figure out what to do, but things can be done. nobody will, it may not make everybody happy, but there are things that can be done if you follow the guidelines and figure out the protocols as we've discussed today.
Something
Karen,
to add to that question that's a little
Yeah.
go
different
ahead,
than
Laura.
the others is that she said people can just walk up and join in. So if there's a way you can prevent that, first of all, that's good because you want to monitor the movements. But another thing you might do, I don't know how much work this is really, but depending on the size of the event, is you could create, I've seen them do it in schools, little circles on the ground where 4 people can fit who come in a group together, and then distance them. And you tell people, well, if you can have a maximum of 4 people, if you can fit in that spot, you can sit there. Like now, again, some of these issues come into like, it's more an issue of enforcement than safety, which she mentioned.
Yeah.
That's a consideration.
I'm going to jump in real quickly. I think there's a lot of wisdom in the room with the participant group that we have. So I'm going to encourage people to share 2 things in the chat. One, what you are doing along the lines that Dr. Laura was just talking about, what your plans are. And another, kind of in response to something that I think a number of people are thinking about and that Norma has articulated, which is trying to plan further out. You've got people, members of your organization that are really dying for in-person. I mean, they really want in-person. That was a really bad choice of words. They really want to be together in person, and people who are really not wanting that. So you're left as the leader determining what that timeline is going to be for in-person. And there's enough wiggle room that you can make a variety of choices. So it would be really interesting, I think, to hear from others what their thoughts along those lines are. I responded just briefly and said that from my perspective, setting something for online with the option to take it in person if conditions seem to warrant that does seem to make sense in a lot of cases. The worry about having people who want to gather in person denied that option and worry that then they feel unheard, I think can be dealt with in a variety of ways. But any wisdom that the group wants to share in the chat would be welcome.
Karen,
you.
you did remind me that there
Sorry,
was
go
something.
ahead, Aaron.
Yeah, there was something that I wanted to share with the group this day, and hopefully you've experienced this. All the organizations have experienced this, but as I mentioned, we've been surveying visitors to assess their comfort level was our main purpose, but we also took open-ended comments, and we have received just the most overwhelmingly positive praise and gratitude that we have ever received for being open and doing it safely. And it's really been a boost to the staff who have, been in somewhat scary, little trepidation about, continuing to be open and operating. But to hear people's response, and how much they appreciated it has just really made a huge difference. And it's reminded us why we exist, that, oh, the arts are important. People do need the arts. We add a lot of value and meaning to people's lives. And so for us, even though it's been scary, it's also been a boost for us. Michael Sandra asked,
Aaron, I just want to say, Aaron, I think that's so important because no one knows what the future holds, and we're all doing what we think is right based on the science, and you can only do that. You can't pretend that we're in a world where things can be different. And so I think people really appreciate the transparency and the knowledge that you're really working hard on this, So thank you for sharing that.
Michael Sander asked a question. He said, if his organization is in a bubble, kind of like a summer camp atmosphere, and they're tested prior and tested during, what extra precautions need to be in place if we are taking these precautions ahead of time?
So testing prior and testing during, so summer camp, does that imply that they're together for a week in a bubble?
I think he said for our organization, so I'm wondering if he's meaning staff or performers who might be together for an extended period of time.
Okay, so they're working together on a display or on a performance. And so there are, Testing is very important, but also, again, the communication about limiting their exposure. So we talk a lot about the workplace and what people do in the workplace, but we need to think about what they do outside of the workplace too, because you can be as safe as possible during the day, but then go home, go to a bar, go to a party, get exposed. What do your family members do? What's your living situation? So I know what a lot of people do is like have a fairly strict quarantine and then test. Now, if there's like 10 people who work together, I think monitoring exposures, it's kind of hard when I don't know the exact situation, what to say. But I think, A is what people's behaviors are outside of work, B, wearing a mask, C, testing is good. How often you test is another question. And if you're in that bubble and certain arts groups have have contacted me because they do have like a group who's practicing their instruments together or something, for example. And one person in the group says, I'm not feeling well. What do you do? So then what we do, I said, well, make sure they quarantine and get tested, and then, let the other people know, protect the confidentiality, and, quarantine for a little while and have them tested too, because you don't know, but it could also just be a cold, right? So I know that sounds a little vague, but it depends on the situation.
There were some questions just about how important sanitizing surfaces and equipment is. And Catherine asked about if she's assigning kids a backpack, does she need to sanitize the supplies and tools every session? My assumption is if multiple people are using the same backpack, then you might want to do it. But if it's the same student using it every day, then it's probably not necessary. How important do you think?
It's really good that you're assigning them their own equipment. And I don't know the age of the kids, but the one thing you could do is make sure there's little sanitary wipes available and teach them to sanitize for themselves. Probably a good thing to learn.
I don't know if an interesting process for the pain, because we're an arts organization, arts museum, but we're also a historic house. And one of our biggest challenges initially was finding disinfectants that we could use on all the different surfaces without harming them. And so we have about 7-8 different products we use, from, the bleach, rubbing alcohol, hydrogen peroxide, and you have to pay attention to how long you leave those, what dilution rates they are and how long you leave them on surfaces. But yeah, the sanitizing that's been daunting. We have a staff member who just frequently goes through and sanitizes, but there's no clear, guidelines on how much you sanitize. So with that, we just try to do it as best we can and do it consistently.
And focus on the high touch areas, doors, handles, things. Yeah.
Yeah.
So it's 10 o'clock. I think maybe we can just look at this one more question from Jill Steiff about opening with a limited capacity with kids. That kids is even more complicated than grown-ups. Any thoughts about this question, Laura or Aaron?
Well, it's a children's museum. That is tricky.
That's hard.
I don't have great guidance for that. I'm not sure, Laura, if you have any thoughts about that.
Yeah, it's a long question, so I was trying to get through it all, but it sounds like you're doing some really good things in that families have individual spaces for an hour. That's good. Then you close down for an hour, you sanitize, reopen an hour later, you require masks. Free roaming spaces is going to be tough because kids are hard to, control. They like to run around and tackle each other. And, right now we're trying to get kids back in school. So anything that could jeopardize their ability to be in the classroom is concerning. And again, can you bring fresh air in? So I think limited capacity, I think having the pods is good. And I think until, because it's going to be a while before we can vaccinate kids. So they're just a whole separate concern. But I think what you're doing right now sounds really effective.
Right.
I don't know, Jill, if this would work for the building for kids, but I'll just share it that it was something we did last summer that was very popular is we designed a scavenger hunt. And we were doing timed entry, but they could look for gnomes in the mansion and gardens. But it was, besides timed entry, it also had a pacing of, you go to this room, then this room, then this room. In the gardens, there was a certain path you were supposed to follow. So it just kind of naturally kept people moving and looking and separated. So I'm not sure if that applies to your space, but that was an activity that worked.
And that's a really good suggestion too. If you have it so you can arrange it so it's a one-way path, and even mark the floor, like you can stop playing this area and then you move to the next one so they're not just all over the place. That would keep it a little more controlled.
Good luck with that. Thank you. We have more questions, but as I just put in the chat, if you have questions that haven't been answered, please send them to me and we will get them answered as best we can. We will send out follow-up information with the recording and lots of links. Karen, any final words?
Thank you all. We'll capture the sharing that happened in the chat as well. Yeah, Anne, and we can get that out as part of that. So thank you.
Yep.
Yeah, Dr. Laura and Erin, thank you so much for leading this. This was really helpful.
We appreciate your knowledge and willingness to share, and thank you all for what you're doing, and we will keep in touch.
Thank you.
Thanks for
Thank you.